Hi, I'm Joseph Harvey. I'm the editor of Animal Farm. I'm currently in London at the Animal Health Investment Forum for Europe, and I've just hosted a panel discussion on African swine fever. And one of the panelists is here with me, Dr. Linda Dixon of the Pirbright Institute. And Linda, I just wondered if you could give a brief overview of some of the topics that we spoke about on the panel.
Okay, yeah. Well, we spoke about the huge impact that African swine fever's had on the pork industry. So there's been a huge reduction in the Chinese pork herd, and that's had a knock-on effect on global pork supply. And there's been a huge upsurge in interest in, for example, developing a vaccine. So there's no vaccine for African swine fever virus. And all of a sudden we find that, literally dozens of companies are interested in work towards developing a vaccine. So we've been carrying out research for at least 15 years on some of the basic research that would underpin vaccine development. And now we're bringing those ideas to fruition by collaborating with different companies to try and produce something that eventually can be brought to the market. So like we discussed this morning, there's still a long way to go to have something ready for use in the field. So there's experimentally some good vaccines, but to use those in the field, they have to be produced in a commercial environment. And like for example, for the live attenuated vaccines, there aren't the cells available to grow those up. And then of course they have to go through the whole regulatory process. So really we're probably talking about up to 5 years to have a vaccine on the market in Europe. I mean,
that's the general estimates, isn't it?
Yes.
Are any of your partners at this conference?
Yes, they are actually. So this is my first conference of this type, and I was surprised to find that actually all of the industrial partners that we're working with are represented here, and arranging some meetings with different vaccine companies and diagnostic companies to have a discussion with them about prospects for African swine fever vaccines and diagnostics later on.
And so, could you give an overview of the of your role at Furbright? Is its focus just on African swine fever, or, and how has your role changed over the last year or so as we've seen ASF hit the headlines with even more frequency?
Yes. So my role's entirely on African swine fever. So I lead the research group working on African swine fever. So altogether it's probably around 15 postdocs and students at Pirbright working on African swine fever in the diagnostic reference lab, which is the OIE reference lab, and on different aspects of the vaccine research, so either subunit vaccines or live attenuated vaccines. And I think how I've noticed it change over the last year is that all of a sudden there was a huge interest from the press and from different researchers and from China. So I've been to China I think four times.
Oh, okay, that makes sense.
Yes. So because before African swine fever occurred in China, none of the research groups there were allowed to work with the live virus. So it was their first experience of working with live African swine fever virus was October 2018. So they had to start from scratch really to build their research program, and I have to say that I was really impressed with how quickly they got up and running. Yeah. And they've made some quite big advances in vaccine research and also scientifically. So they got a paper out in Science earlier this year with the first cryo-EM structure of African swine fever virus. So they managed to do that in a few months, which might have been normally about 3 years research. Yeah.
And so what's the latest from Pirbright though? Because there was you had an update last week that I thought was with some really interesting news.
Yes, so we've been collaborating with different groups. So with UCL London, Professor Finn Werner's group at UCL, who's an expert on transcription, we investigated for the first time the complete global genome transcription map. So we studied how the genes are expressed, when they're expressed, what their start positions are, what their end positions are, and that study identified about 30 new genes that before we hadn't recognized were actually expressed. Some of those are expressed at very high levels, and we also identified different classes of proteins expressed at different stages of the replication. So that's giving us clues into the functions of those genes, because so many of the African swine fever genes have no known function.
Yeah.
A third to a half, we don't know what they do.
Yeah.
So it's been a big plus for the science and also for vaccine development, I would say as well, because we now have the precise position of the starts of those different proteins, so we have got the precise protein sequence.
So what do you think, what's next? What can we expect next on the African swine fever vaccine development timeline?
Right.
Or is it completely unpredictable?
Well, I think we're still going to see some papers coming out with new vaccine candidates, so we're getting a much better understanding of how the virus interacts with the host and which genes are important for the virus to control the host responses to infection. So I think we're going to get a lot more papers coming out on that aspect, which of course will lead to new candidates for live attenuated vaccine development, and also there's more work in the pipeline to identify which antigens might be protective. So those are the next things, and there's also some work which we're about to publish actually with a group in the USA on a macrophage, pig macrophage cell line which supports the virus replication. So that could be a route to produce the live attenuated vaccines. So I hope that's going to come out very soon.